Gottfried Hirnschall, who's the Director of HIV/AIDS programs at the WHO. Thanks for joining us today. One key issue that's being discussed here at the conference is funding for HIV/AIDS programs, concerning that it's getting cut. There are also competing concerns with other global health issues. How do you think funders can balance those concerns and those funding issues?
I think the important thing is really to reassure those who work in disease-specific issues that by combining interventions, by integrating services, that wouldn't mean that individual programs would be negatively affected. And I think those anxieties we see in many of the gatherings that we have, and we hear it here in Vienna. So I think it will be important to really have a logical approach to looking at health outcomes as defined in the Millennium Development Goals. I think it's a very good guide to do that, and to really see what is needed in order to reach those health outcomes. Working in WHO, working in HIV, being responsible for the HIV area, I can share with you that we are also affected by funding constraints at this point, but we also see by working more effectively, working more closely with our colleagues that work in maternal and child health, for example, our colleagues that work in health systems, as an opportunity, number one, to optimize our work, number two, to work towards more integrated services, and also to rationalize the use of the resources.
You mentioned that there can be lessons learned from implementing these complicated delivery systems like antiretrovirals to other global health issues. What are some of those lessons that implementation of ARV treatment can teach us?
Well, I think we have some good lessons and we have some difficult lessons that I think we need to look at. ART programs, what we have been seeing is that with the resources that are needed, with the political commitment and the political will that is required, and with the tools that are available, in this case the guidelines, and in this case the medicines, in this case also the trained health workers, you can scale up services relatively quickly. What we are, however, seeing as I think an important lesson is you can reach a certain point. And you can reach a certain point after which you really have to think about how you will sustain after a phase of rapid scale-up, and that is exactly the moment in which we are. This is exactly the theme that this conference will, the topic that this conference will discuss, I believe, quite in detail, to say, well, where do we go from here? We want to make ART available to more persons, to those who require this. We have a gap of 10 million people. The resources might be going down. So how do we deal with this? And this is where integration comes in. This is where efficiency savings need to be considered, while making sure that we have also ways of ensuring that funding remains available.
So for you, what are the key issues for sustainability, whether it's ART treatment or maternal and child health?
I believe very strongly. I'm originally coming from child health. I've worked there many years of my professional career, and then shifted more and more pediatric HIV and then towards HIV. I believe what's happening right now is a very healthy, is a very needed dialogue. It's a great conversation. It encourages me. I believe we need to make sure that we maintain a strong focus on health-specific outcomes, disease-specific outcomes, like HIV, like maternal health, like child health, but we need to really put them together. So these are three things, definitely, MDG4, MDG5, MDG6, definitely things that I would put into the basket. What I think we also need to add is how can we make sure that across those priority outcomes, we can strengthen the system and build the systems that are needed to deliver in a more comprehensive and in a more integrated fashion.
And last question for you, how is it being here for the conference in your home city of Vienna?
It feels great. I'm actually quite proud to have so many people here in Vienna. I haven't lived here in 25 years, but this is still my hometown. This is still where some of my family lives, and I'm really hoping for a very exciting conference. I'm hoping for a transparent conference, and I'm hoping for a conference that really looks at the issues that we are dealing with, and also one that speaks beyond HIV. I think we need to focus on HIV, but we need to listen to what's going on around us, and we need to also see how we can more strategically position ourselves as the people who work most closely in HIV in the broader context, in the health agenda, in the health and development agenda.
Dr. Hirnschall, thank you so much for your time.
Thank you very much.